Today we have with us Dr. Suresh Kumar, Joint Advisor Ayush, Ministry of Ayush. He is an MD in Ayurveda, specialized in Panchakarma. He has joined the Ministry of Ayush as Research Officer in the year 2009 after clearing the UPSC examination. At present, he is serving as a Joint Advisor in the Ministry and currently designated as the Divisional Head of National Ayush Mission Scheme. He is also looking after the work of Ayush Grid Division in the Ministry. Further, he had also been designated as Deputy Drug Controller, Government of India in the past. During his service period, he has also participated in various types of conferences, seminars, conclaves, and workshops time to time and represented the ministry nationally and internationally. He has also led the central team during field visits of different states and UTs to monitor the progress of implementation of NAM scheme from time to time. Over to you, sir.
सबसे पहले आप सभी को सादर नमस्कार। इसमें कुछ चेहरे तो मेरे नोन भी हैं एंड कुछ लोगों के साथ तो मेरा काफ़ी इंटरेक्शन भी हुआ है एंड आई एम वेरी हैप्पी टू नो इट कि इसमें बहुत सारे लोग एकेडमिशियंस भी हैं और बहुत सारे लोग मेडिकल ऑफिसर यानी फील्ड में डायरेक्टली काम कर रहे हैं। बेसिकली वॉट एवर यू हैव heard from the Raghu sir, you can understand how much detailed discussion has been carried out in presence of experts of different institutes, including National Institute as well as research councils, and also during the discussion, experts of modern system has also been consulted. And after such a thorough discussion, such type of STGs comes in front of us for effective implementation in the field. So I would like to congratulate whole team who have provided their active participation and their valuable ideas for such type of guideline preparation. Really, we appreciate the efforts of DGHS Vertical and all the consultants who have provided their valuable. Now, question arises, if any particular guideline has been prepared, what is the objective? That has been highlighted in detail by the Raghu sir. So I am not going into depth of those things. But simply I want to give a thought to all of you. When we are studying either in EMD, basically in EMD, but sometime when you are going to get orientation during the time of preparation of the PG or in the time of intensive, you have observed what is research. Research is simply a systematic, refined technique of thinking, employing specialized tools, instruments and procedure to obtain a more adequate solution of a problem than it is possible under ordinary means. And in our day-to-day life, we are facing such type of challenges. Wherever we are facing any challenge, immediately some thought is coming in our mind and we are thinking how it can be addressed. And this type of thought when arises in our expert's mind, in our DGHS vertical expert, Dr. Raghu sir, immediately he has taken a call under consultation with DGHS head as well as Ayush Ministry officials. We have to develop some module, we have to develop some guideline which may provide a facilitation to our field officials, including academicians, so that they may take a call with respective holistic approach of healthcare, not only by the system of Ayush system, but as per the requirement, they can integrate with modern system also. So you have heard in detail. Now what we have to do? Now this particular guideline has been developed and who will implement these guidelines? So all of you are the resource person, all of you are the pillars, और मुझे किसी को ये बताने की ज़रूरत नहीं है कि आपकी रोल एंड रिस्पॉन्सिबिलिटी क्या है। आप सब एक्सपर्ट हैं, हमने जो किया है वही आपने भी किया है। बस इट्स माई लक कह लें या एक मौका मिला, मैं आज यहाँ हूँ और आपको मौका मिला आज वहाँ। अल्टीमेटली एम इज़ नथिंग बट ओनली दिस, वी हैव टू प्रोवाइड बेस्ट टू बेस्ट हेल्थ केयर टू द कम्युनिटी वॉट एवर पॉसिबल. We are preparing the guidelines, we are implementing the schemes from the ministry, but ultimate aim is nothing but only this. We have to provide holistic approach of healthcare to the community by involving different types of procedures, instruments, and by involving all the Ayush experts belonging in different parts of the country. With respect to this, what is the aim of ministry? Ministry of Ayush is implementing a centrally sponsored scheme that is called as National Ayush Mission with the support of state and UT government for overall development and promotion of Ayush system in the country, for providing appropriate health care to the community. And under this scheme, Ministry is supporting the efforts of state and UT government under different ways by providing financial assistance to them under different activities like infrastructure development, upgradation of existing standalone Ayush hospital and dispensaries, implementation of different public health programs, and whatever the budget is being allocated to the states. For example, if we are allocating 100 crore to a particular state, then at that time we are deciding to earmark 25% of that 100 crore under flexi pool activities. And that flexi pool activities is for the purpose in which state or UT government may take a call as per their felt need, whatever activities they want propose, they can propose. This liberty has been given to each state and UT government. Whenever they are going to prepare state annual action plan, we have formulated a National Ayush Mission guideline and tentative activities has been highlighted within those guidelines. I am not going into detail of those things. Simply you can understand infrastructure development, support for supply of medicine, deployment of contextual manpower to fill the gaps, as well as for skill orientation training related activities, for quality related compliance, NABH and other things, some financial assistance is being provided. And in addition to that, for strengthening of state level administrative work, we are also supporting for state program management unit as well as district program management unit, because we know it very well, our medical officers are too burdened, our academicians are having too much load and they are involved in different type of activities. So parallelly we are thinking in such a way, we have to give dedicated district program management unit, we have to give dedicated state program management unit by providing flexibility to the state and UT government so that they may take a call and provide their focused attention with respect to effective implementation of NAM scheme in the field. And only as per the requirement with respect to technical expertise, our officials may be contacted and their utilization time to time may be carried out with respect to holistic approach of healthcare. So this is the background of National Ayush Mission scheme. Sir has informed all of you in the morning session that National Ayush Mission is having the budget pool with respect to IC and BCC. I would like to highlight here, whatever you are thinking, you can implement, there is no problem at all. Only problem is this, whenever we are receiving the plan from state government, we are unable to get what actually they want to do. For example, if a particular medical officer is thinking, this particular belt where I am posted, some problem is specific, like sickle cell anemia, like filariasis. Then we have given certain protocol in the National Ayush Mission guideline. If he or she has taken some remedy with respect to improvement and observe it is having good result, they can pilot those things by the help of state government by providing their inputs. These are the medicine which we have been adopted. These are the selection criteria of the patient. It is requested you may adopt this model in such type of areas by taking some innovative program under National Ayush Mission so that it may be implemented and it may be documented, and after documentation you have to share the result to the ministry so that best practices can be replicated in other states also for providing benefit to the community. But what happens generally, majority of the medical officers, majority of the academicians are having a lot of tasks and they are having very limited time. So we have requested to state and UT government for constituting some committees, technical expert committees, so that they may consult and they may visit the different areas of the states, districts, and decentralized state annual action plan may be prepared instead of centralized. Generally, what happens if we have communicated resource pool of 300 crore, immediately we are getting the SAP, but that SAP is coming from the state level. They are not going to consult district Ayush medical officer. They are not going to take feedback from the officials who are working in the field. And due to this, sometime mechanical state annual action plan is coming, and that is the result why it is not being implemented appropriately in the field. So whatever we are going to plan, we have to execute those things. And with respect to execution, all of you are the pillars. But with respect to proper orientation, it is the responsibility of the state government. They have to prepare a team. They have to design a model how the things can be rolled out. With respect to training, a particular training calendar should be developed. Now, whenever we are going to review the National Ayush Mission, we are going to request, please project training calendar, which type of training you want to conduct, how many resource person will be involved, how many participants will come, and what impact will be provided by the help of this training, so that we can understand these are the training protocol and these are the training criteria and how they can implement those trainings. Now I am going to discuss the things in detail. Ministry of Ayush involved creating, whatever Raghu said, told all of you, things are almost same, but now I am going to specify the things where your role is more important. And I would like to highlight one thing very important. Recently, as per the direction of the Honorable Prime Minister, 6 department has been given the task for conducting departmental summit. Departmental summit is a type of summit in which Honorable Minister of the central government of that particular department, for example, in case of Ayush Minister will chair the meeting, and all the principal secretaries of states and UT government, as well as mission director and commissioner, as well as Ayush director, whosoever available in that particular states and UTs, have been invited in that department summit to discuss the things in detail with respect to different aspects like implementation of norm, quality parameters and other things. And parallelly, it has also been suggested to us, we have to take feedback inputs from the officials who are working in the field. I am thinking that some of them have provided inputs also. We have circulated that document, that feedback form, which has been received from the Niti Aayog, and obtained feedback from all the field level officials, which type of challenges they are facing, what are their suggestions, how those challenges can be resolved, and what will be the way forward. And after compilation of those things, we have conducted a departmental summit in All India Institute of Ayurveda in the month of September, where majority of the senior officials of the states and UT governments were available. And after thorough discussion, we have decided there is need of some amendment in the guideline, and accordingly now we are proceeding for the same with respect to next plan under Empowered Finance Committee note. So your suggestion is most valuable. Whenever we are going to review the things in field at the level of regional review meeting or in the field visit, we are always very keen to hear the challenges and suggestions from the field level officials. We are sitting here, we are not knowing what is the actual problem. Really, whenever you are guiding us, this is the basic problem. फॉर एक छोटा सा एग्जाम्पल देता हूँ. अभी हमने रिसेंटली विजिट किया एक स्टेट में, सॉरी, एक डॉक्टर का कहना था कि वी आर हैविंग लिमिटेड नंबर ऑफ मैन पावर. हाउ कैन यू एक्सपेक्ट कि हम ये HMIS का भी डाटा भर दें, हाउ कैन यू एक्सपेक्ट कि हम DBT का भी डाटा भर दें, हाउ कैन यू एक्सपेक्ट कि हम जो है आपका डिफरेंट प्रोग्राम की रिपोर्टिंग भी कर दें. देन इमीडिएटली वी हैव टेकन ए कॉल. We have decided whenever we are going to implement public health program, we should have to provide some supportive manpower, and accordingly with respect to public health program, whatever has been introduced in the National Ayush Mission like musculoskeletal, Supraja, Biomitra, Karudya and NPCDCS, everywhere we have make a provision for contextual manpower so that our medical officer may not suffer for such type of activities. Only whatever we have suggested in the guideline during the time of preparation of action plan, you may map the facility very clearly. For example, if any NPCDS program has been taken for a particular block, so they have to map where is Ayush dispensary, where is Ayush hospital, where is Ayush educational institution, where is allopathic CSC and where is PSC, so that appropriate referral mechanism can be established, because at the level of OPD there are certain limitations, and after that how that referral mechanism has been established, that has been decided in the guideline, and you can understand on the basis of that, and a dedicated SOP can be prepared. On the basis of this STG, you will get a path for effective implementation of different types of non-communicable diseases, so that it can be streamlined in all parts of the country in an effective way. NAM implies a multi-pronged strategy to ensure the effective purpose means नाम ही एक स्कीम है भारत सरकार की जो कंट्री के हर पार्ट में अवेलेबल है, इसलिए इससे एक्सपेक्टेशन भी ज़्यादा है. And now what happens, we have also decided कि if there is a vacancy in a particular Ayush dispensary and due to some administrative challenges, state government is facing problem in recruitment of that manpower, we are also supporting for 1 year with respect to contextual manpower subject to the condition. During the meantime, they have to take appropriate measures for deployment of permanent post so that facility may not suffer. Development and transition of developing public health strategies and STGs done with the technical already sir has explained in detail. Consultation has been carried out from different officials. This is a simple data, all of you are well aware, I am not going to highlight those things in details. You can understand if we are unable to check the problem of NCDs, then it will create a lot of hurdle. It has been taken from the Google, so you can obtain everywhere such type of information. Sir has highlighted capacity building. Problem is this. What is the base for capacity building? Everywhere fund requirement is available. So National Ayush Mission is giving full empowerment to states with respect to 25% flexi budget as well as 4% of the total approved SAP. We are going to provide approval to the states and UTs as a admin cost. And within that admin cost, they can also use the fund with respect to training and capacity building. Under Flexi Pool, we are providing IC related fund also that can also be used. However, as per their detailed plan and detailed proposal, if they are going to propose any training related activities, that are being immediately supported by the ministry. So there is no problem of budget, but problem is this: whatever the grant we have released, utilization of those grant must be carried out by the state within the time frame, because it has been issued, a strict guideline has been issued by the Department of Expenditure. Whatever you have released in the previous year, 75% expenditure of that amount should be carried out so that next installment can be released. So ministry disseminates STGs, so we have already doing the work. Accordingly, when Raghu sir has decided for training, to National Ayush Mission has taken a call, written letter to the state and UT government for nomination of all respected officials who are available here, and I am very happy within very limited time they have given very positive response, and I am also thankful to all of you कि even after Deepavali and Chhat celebration अभी तो चल ही रहा है, all of you have listened the voice of the ministry and actively participated in the TRIS training program. Basically, whatever you are going to learn from here, that is only guidance. all of you are well aware and you can understand that these are the challenges in our states, these are the challenges in our UTs. But when after getting the training you will give report to your state officials, we will take feedback, whatever the suggestion is. And if they are going to say we are having constraints of budget, if they are interested, ministry has decided to take a call. Whatever budget available with them, they can project for training activity within that budget also. So ministry will revalidate that amount with respect to activities under flexi pool as per the requirement shown by the state government. वही चीज़ें जो मैंने आपको हाईलाइट की बजट प्रोविजन के बारे में कि कैसे बजट हम देते हैं, और जो लास्ट लाइन है सेकंड लाइन नाम देयर इज ए बजट प्रोविजन फॉर ट्रेनिंग एंड कैपेसिटी ऑफ टीचिंग स्टाफ, मेडिकल ऑफिसर and other paramedical staffs working in educational institution, Ayush hospital, dispensaries and public health programs. Everywhere training component is available. Whatever program we are implementing, everywhere IC and training component is included. Only main problem is this execution, appropriate training calendar and execution. And state has to take a call with respect to a dedicated training institutes. If training institutes are not available, why not they can explore the possibility of our educational institution, because there is vast experience. A lot of academicians are having vast experience. They may go through and they can design the training calendar on the basis of their experience, and on accordingly at the regional level they may project plan to us. We have decided this region in a state, and at that place they may invite the trainees and provide them training, and after getting those training they can disseminate the training in downward direction at the level of block, at the level of dispensary also, by inviting them. And whatever resources in the form of fund is required, that can be provided under National Ayush Mission as per the projection made by the state and UT government. Key strategies. What key strategies is required to be designed, ensuring in uniformity and quality? Already Raghu sir highlighted in disease. STGs, standard clinical procedures and treatment approaches, ensuring uniformity, quality of care across various आयुष facilities. There are certain limitations. आयुष्मान आरोग्य मंदिर में हमें एक लिमिट तक काम करना है, उसके बाद उसको रेफर करना है. आयुष डिस्पेंसरी हॉस्पिटल में certain limitation है. Those limitations has already been identified, and accordingly after thorough discussion those limitations has been given a path with respect to referral criteria, and that has been highlighted in the STGs also. Facilitating integrative care. For example, sir has given an idea about co-location. Co-location basically a concept in which it has been decided by the Ministry of Health and Ministry of Ayush. It is a joint venture. Ministry is supporting infrastructure as well as medicine, and manpower is being supported by the health department. With respect to this, without proper coordination between health and Ayush, effective implementation of the STG is not possible. So there is need of appropriate coordination and integration, enhancing practitioner skills on the basis of different things which a format has been highlighted by Raghu said. There is a need of different literatures has been reviewed, their classical symptoms has been highlighted, line of treatment has been highlighted, investigations has been highlighted, treatment protocol has been highlighted, whatever path and apathy, everything is available. So at a time if anybody want, he can refer, he can understand what is actually required with respect to appropriate care of the patient. Strengthening regulatory framework. Ministry is also taking a lot of calls with respect from Drug and Cosmetic Act, and with respect to that a dedicated section in the ministry, that is drug policy section. They are coordinating with the state licensing authority for quality medicine. They are going to give certain directions to them time to time to check the misleading advertisement and other things, and they are ensuring effective implementation of regulatory mechanism has to be developed in states and UTs so that quality of care may be provided through quality medicine as well as different activities of misleading advertisement may be checked so that there is no miscare. You can say sometimes somebody is claiming I can treat this, I can treat this, I can treat this, and we are facing a lot of defame through those things because we are not having the validated documents. On the basis of that, it has been decided there is a need of validation, and this STG is also the part of that. Whatever research council has done, whatever national institute had done, those they have provided their valuable inputs, and whatever already standardized and whatever already validated, that has been documented accordingly. Integration of Ayush, this particular program I want to highlight here. This particular program has been introduced by the ministry under consultation with health from the year 2006. But this task has been given to our council, CCRS, CCRH and CCROM. And they have implemented these programs in 6 states, and those programs were implemented in PSC, CSC and DH. And NIHFW has conducted a study and observed a good impact of this particular program through different Ayush interventions and suggested it can be implemented at broader level, and after that we have introduced this program into the National Ayush Mission. Training material on NCDs we have already provided, we have given orientation, and we have provided appropriate modules with respect to yoga, with respect to CHOs. CHOs are basically Ayush medical officer who are working in Ayushman Arogya Mandir. In our permanent setup, permanent Ayush medical officer is also looking after the charge of community health officer. However, those sub-center which has been upgraded, that is contextual CHO available at there, and they are providing their services. Orientation of yoga instructors, yoga training to ASHA, and common yoga protocol has been provided to states and UTs, and those common yoga protocol training has also been given to ASHAs ANM so that they may involve themselves with respect to such type of yoga related intervention. I have highlighted you since 2016 it has been implemented, but these are the only 6 states. In a pilot mode this study has been carried out. Now we are going to implement in other part of the country also, because some of the states I have highlighted here, you may understand, Jammu Kashmir, Madhya Pradesh, Chhattisgarh, West Bengal, Kerala. Although Kerala, Chhattisgarh, Madhya Pradesh, as per the guideline we cannot support to them, but they have projected this activity under FlexiPool by understanding the fact that it is beneficial, and they have given good result to us in the form of reporting what Raghu sir suggested. We are getting information as per the direction of Niti Aayog with respect to output and outcome indicators. We have provided certain indicators in the National Ayush Mission guideline with respect to output and outcome, and in the Niti Aayog annually they are going to analyze our schemes, especially to the programs, and getting information from us what is the impact, how many villages you have covered, how many persons have been screened out, which type of Ayush intervention you have adopted, and what is the improvement. Can you give us some idea? They are asking specifically, member Niti Aayog has highlighted it, BK Paul sir. Can Ministry of Ayush give any idea how many villages they have closely observed about the non-communicable disease, especially diabetes, hypertension or hyperlipidemia like conditions, gout. Condition before implementation of program through Ayush intervention was this, and after implementation what is the improvement. But right now we are not having such type of substantial data and substantial information, and accordingly we have decided to implement AHMIS. We are in the final stage, and pilot testing is going on, we will give AHMIS tool to all the states and UTs, especially for implementation at the level of Ayushman Arogya Mandir, because they are directly connected with the villages areas, so that we can understand what is the status before implementation and what is the status after implementation. And during the meantime, we have requested to the states and UT governments, please share the information, at least how many villages you have covered, what is the status, at least as per your register of the non-communicable disease in terms of hypertension, in terms of diabetes, and which type of Ayush remedies you have adopted. Please highlight us, and what is the impact you have analyzed. Some of the states has shared, and quite remarkable achievement has been made. There is no doubt in it. We have given diagnostic kits to them with respect to testing, and whenever they are going to visit field, they are also utilizing those kits and providing time to time quarterly information to us, and those information are very courageous. And it is very, very important for all of us. We are going to show our strength with respect to non-communicable disease, so it will definitely give a great importance to the Ayush ministry as well as Ayush fraternity, because you can understand these type of lifestyle disorder not only be managed by the help of medicine, but there is need of appropriate IC and BCC, and Ayush is having a great strength for that in the form of Dincharya, Adharaniya Beg, in the form of Sadbrit. Appropriate IC material is required to be developed. Ministry has dedicatedly earmarked certain amount with respect to IC material. State and UT government may avail assistance from the ministry under NAM, and they may develop, they may translate into the regional language, and a lot of those materials has already been disseminated, and in future those material will be provided from the ministry to the states, and councils are also providing their active role in such type of development. So hoping in future, definitely with kind support of all of you, we will achieve a goal, and we can highlight due to appropriate intervention of Ayush therapies, Ayush treatments, as well as yoga related activities. In addition to that, appropriate IC and BCC, we have achieved a good result in the process of checking of non-communicable diseases. So at the level of district and PSC, CSC, we are doing the things. Here, just I want to 3 levels we are working. District and CD clinics, CSC, it is an integrative approach. Only CSC and district hospital and PSCs are being taken. In addition to that, whatever Ayushman Arogya Mandir has been developed, they are also working very closely with respect to NCDs, and not only our Ayushman Arogya Mandir, our educational institutions are also conducting dedicated OPTs with respect to these type of problems, and hoping in coming days better outcome will come. These are the states where we have given, it is just a picture to all of you for understanding. In this way we are supporting 2 states. Those states who are projecting us, we are providing assistance and with respect to implementation. So this is only for PSC, CSC and DH. In addition to that, we are supporting in different programs as well as through Ayushman Arogya Mandir also. Objective primary prevention of NCDs through health education, already things has been discussed in detail. You are well aware, I am not going to explain these things in detail. I just want to highlight important thing, how you can get, because many times you are not having time to read the National Ayush Mission guideline. But when you are going to listen from my side, such type of provision is available. Then कभी टाइम मिलेगा तो मन करेगा तो आप भी खोल के देख लोगे, है अच्छा लाओ एक प्रोजेक्ट बना के भेज देते. Either they are going to consider or not consider, it is another issue. But whenever you are going to project, I am giving liberty to all of you. If you want, you can talk me and also share me your project. I will talk to the state program management unit, and if that is not repetition, that is a new thought, I will definitely discuss with those officials and try to incorporate those things in SAP if it is really beneficial with respect to the community. So my request from all of you, think in a positive way, prepare some action plan with respect to your innovative ideas, and try to project those things in state annual action plan so that same can be implemented by all of you. This is the norm. It is just a simple idea. At the level of district NCD clinic, we are providing 12.96 lakh. At the level of CSC, we are providing 9 lakh. Outroad PSC 1.92. But in addition to that, as per the requirement projected by the state government under flexi pool, we are also assisting them. It is only just for CSC, PSC and DH. Any hospital, any dispensary can take assistance from the ministry if they want, but proposal should be justified, appropriate strategies should be designed, and SOP with respect to implementation has to be shared to the ministry. This is the motive. How screening, prevention, control of management of non-communicable disease activity and Ayushman Arogya Mandir Ayush I have highlighted here. Why? The purpose is because they are directly connected with the field. For example, our academic institutions are also connected at certain places, but they are not going into detail with respect to village level persons. But our dispensaries and Ayushman Arogya Mandirs are closely associated with those people. Care at community level, what we have to do, that has been highlighted in the guideline of the operational guideline of National Ayush Mission as well as Ayushman Arogya Mandir. What is their role and responsibility? What is the care required at the level of facility? Individual diagnosis, yoga session, diet lifestyle, pre-diabetes, diabetes condition ka diagnosis, and after that appropriate dietary advice as well as treatment. Care at referral site, you can understand by the help of STG up to which level you may provide treatment, and after that you may refer to the cases at the higher level. And expected outcome, same as highlighted by Raghu sir, because there is no change at all. Only I want to highlight here, with respect to documentation, whatever we are doing, either you or me or anybody, nobody is going to give us recognition. As and when we will highlight our importance on the basis of documentation. For example, you have treated a lot of cases of diabetes by the help of some medicine, by the help of your treatment strategy, but you are not documenting those things in registers, or you are not sharing those things to district Ayush officer, then how can they recognize your strength? So it is very important whatever we are doing in the field, at least whenever the case is coming, we have to bifurcate this much number of hypertensive patient come, this much number of diabetic patient come, and whatever treatment you are giving, you have to analyze this much cases improves and this much cases needs supportive care from other facilities. So in this way, at least if you are gathering information, that will be beneficial. But if it is not going to be developed and you are facing constraints of manpower, so we are requesting to states and UT government with respect to DPMU so that they may provide some assistance to all of you. One thing, whatever I have noticed during my field visit, I have asked many of the medical officers, what is the referral mechanism? Are you maintaining any register? How many patients have you referred in the previous 2 months? I was really very shocked because they are saying कि actually हम जिसको refer करते हैं verbally बोल देते हैं and they are going. But sometime it is very important for which purpose? To highlight the things at the level of policy. We are having appropriate referral mechanism, so we need some amount, some assistance, some manpower, so that such type of information may be captured, may be gathered, and some digital tool may be provided, IT tools may be provided, computers may be provided. Otherwise, whenever anybody, for example, Niti Aayog has conducted third-party evaluation, and they have shared report to us. They are showing weak referral mechanism. They are mentioning no dedicated arrangement for appropriate monitoring at the level of field in state and UTs. So these recommendations are negative for the implementation of the scheme, because we are totally dependent on the states and UTs. Whatever state and UT government is going to implement, success of National Ayush Mission is totally based on that. So all of you are requested to highlight those things whenever you are going to submit report. If such type of facility is required, this is our suggestions. District Program Management Unit has to visit our facility also. Whatever the data we have captured, they have to collect that data. At least if we are unable to fill in computer at our facility level, they may collect the information and they have to fill at the level of their HMIS available in the district, so that that consolidated information may come to the ministry. Bottlenecks to be addressed: limited scientific evidence, and with respect to that, our councils, our national institutes are taking a lot of proactive initiative. Coordination challenges, everywhere it is problem. सबसे बड़ी problem तो हमारे अपने आयुष में है. We know homeopathy is having some strength, and member नीति आयोग has highlighted this particular point in departmental summit. उन्होंने स्पष्ट बोला, सबसे पहले आपको आयुष में भी इंटीग्रेशन करने की जरूरत है. मिनिस्ट्री एक इंटीग्रेटेड आयुष हॉस्पिटल बना रही है, जहां पे आयुर्वेद, होम्योपैथ, सिद्धा, एज पर द फील्ड जहां पे जैसी रिक्वायरमेंट है योगा रहेगा. तो वी हैव टू आल्सो अंडरस्टैंड एंड रिस्पेक्ट ईच अदर. जहां लगे इनकी स्ट्रेंथ है वहां रेफर कर ले. एंड आफ्टर दैट क्रॉस रेफरल appropriate orientation is required, and by the help of STGs you may get proper orientation. And in the states, we are also requesting from the mission directors for appropriate orientation of the allopathic officials, allopathic medical officers, and even as per the requirement, ANM and ASA should also be oriented with respect to Ayush strength, because they are the main field worker and they are closely associated with the community. Possible resource constraints, it is every state is showing this problem, but we are having limited resources. Up to certain level we are supporting, but majority of the deployment comes under the purview of respective state and UT government. Data integrators gaps in NCD surveillance and reporting, it is required to be strengthened, and some digital tools is required to be prepared, and we are also working by the help of Ayush Grid in this sector. So this is all about with respect to National Ayush Mission and with respect to effective implementation. Again, from folded hand, this is my humble request to all of you. हम लोग यहाँ से कुछ भी नहीं कर सकते. Everything it depends on your active participation. Wherever you feel any problem, you may tell us. If there is need of intervention, we will coordinate with the state senior officials and request them to facilitate all of you, so that actual beneficiary who is residing in the rural areas may be benefited with respect to holistic health care. Thank you very much to all of you. हृदय से आप लोगों को धन्यवाद.
एक मेडिकल ऑफिसर फार्मासिस्ट का भी काम कर रहा है, योगा इंस्ट्रक्टर भी वही है, लेबोरेटरी टेक्नीशियन का भी काम कर रहा है, पीटीएस का भी कर रहा है. देयर इज नो एनी सपोर्टिंग स्टाफ मैक्सिमम इन जम्मू डिस्ट्रिक्ट. सो माय क्वेश्चन इज दैट आप थोड़ा सा प्रेशर आयुष मिनिस्ट्री से डालें स्टेट को, ताकि ये जो प्रॉब्लम है सॉल्व हो. ये बड़ा ज़रूरी है सर. मैं रिमोट एरिया से आया हूँ, मैं इसीलिए आया था कि हमारी प्रॉब्लम्स को सॉल्व किया जाए. ये बड़ा ज़रूरी है.
100% agreed, 100% agreed and noted. And for your kind information, मैं आपको ये बताना चाहूँगा कि जो भी हमारे पैरामीटर हैं, जैसे मान लीजिए आप रिमोट एरिया में और पता आपकी डिस्पेंसरी आयुष्मान आरोग्य मंदिर है. आयुष्मान आरोग्य मंदिर में हमने एक क्राइटेरिया बनाई थी कि जब उसको फंक्शनल आपको तभी डिक्लेयर करना है जब उसमें मेडिकल ऑफिसर हो, जब उसमें योगा इंस्ट्रक्टर का डिप्लॉयमेंट हो जाए. फार्मासिस्ट के लिए हमने थोड़ी लिबर्टी दे दी थी, क्योंकि स्टेट्स का कहना था कि फार्मासिस्ट होने चाहिए. और जब उसमें मल्टीपर्पज वर्कर या कोई आपका सपोर्टिव स्टाफ हो जो हर्बल गार्डन वगैरह की केयर कर सके. जो इन्फॉर्मेशन हमारे पास आई, अब उन्होंने हो सकता है गैप फिलिंग को करने के लिए दूसरी फैसिलिटी को कुछ डे के लिए इधर रोटेट कर दिया हो, कुछ उधर. बट वी विल अगेन राइट टू द स्टेट्स एंड यूटी गवर्नमेंट, देयर इज नो डाउट इन इट एट ऑल. We will request them at least whatever the basic norm highlighted in the Ayushman Arogya Mandir guideline, that manpower should be arranged. so that our medical officer may carry out their role and responsibility in effective way. Definitely it will be taken care. But some challenges are there also from state side. They are saying ki some litigation, some other things. So we have requested them ki if you are observing, so some contextual support you may get from us for time being, and we will provide.
इस ट्रेनिंग के बाद जरूरत नहीं है सर।
हाँ।
इस ट्रेनिंग के बाद तो हम जाएंगे अपने स्टेट में, तो मेनली फोकस्ड ऑन द डायबिटीज और द फैटी लिवर डिजीजेस।
हाँ।
तो सर मेरा एक सुझाव है,
बताएं।
कि अब मुझे पता नहीं है कि नेक्स्ट क्लासेस में मैं इसका आंसर पाऊंगा कि नहीं। माय क्वेश्चन इज रिगार्डिंग द मेडिसिन्स। तो जैसे कि एलोपैथ में क्या होता है कि ट्यूबरकुलोसिस में 6 महीने का उनका एक पैकेज होता है, वो लोग दे देते हैं। तो आफ्टर दैट इंस्टीट्यूशन ट्रेनिंग के बाद क्या ऐसा कुछ होगा कि हम जैसे डायबिटीज पेशेंट आए तो हम उनको एक पैकेज दे देंगे क्या? वो नहीं तो क्या रेगुलर ऐसे प्रेस्क्रिप्शन होगा कि पाओ बाजार से लो, मार्केट लो। तो ऐसा अगर कुछ होगा तो पेशेंट आउटकम बढ़ेगा और इट विल स्ट्रेंथन आवर सिस्टम।
नहीं, आपका सुझाव मैं रघु सर तक कन्वे कर दूंगा, बट आप खुद ही एक आयुर्वेदा के डॉक्टर हैं, यू कैन अंडरस्टैंड कि आपके अपने सिद्धांत क्या बताते हैं। क्या कोई पैकेज आपके सिद्धांत में देना उचित रहेगा, नहीं रहेगा, वो आप भी विचार करिएगा। और मैं तो रघु सर को आपका सुझाव कन्वे करूंगा, बट मुझे लगता है ना कि आयुर्वेद का ट्रीटमेंट एज लाइक एज पैकेज दे पाना, मेरी जहाँ तक अपनी अंडरस्टैंडिंग है, क्योंकि थोड़ा सा कठिन काम है और उसको फिर हम एक मैकेनिकल ही हो गया। अगर आप अपनी किसी ऐसे बताता हूँ, आप समझिए, जो मैंने ऑब्जर्व भी किया, अगर आपने किसी को दे दिया कि आप जाओ 2 महीने की मेडिसिन लेके घर बैठ जाओ, उसने कितना फॉलो अप किया, मेडिसिन कितना ली, कितना प्रिकॉशन यूज किया, आपके पथ्य का कितना पालन किया, कितना योगा किया, आपको कैसे पता लगेगा? ट्यूबरकुलोसिस का आपने नाम लिया, क्यों डॉट प्रोग्राम चलाया गया, उसको आप एनालाइज करें तो आपको थोड़ा सा एक आइडिया तो जरूर मिलेगी। बट आई हैव नोटेड, आई विल कन्वे, क्योंकि पैकेज जो होता है ना, वो मेरी अपनी जो ऑब्जर्वेशन अभी तक मिनिस्ट्री में रही है, जितनी भी हमने किट डिस्ट्रीब्यूशन का, तो हम सैप में अप्रूव भी नहीं करते। इट इज़ वेरी डेंजरस थिंग। जनरली लोग किट लेते हैं और किट लेने के बाद
3 days in our state, Department of Ayush, our director Srikant Babu sir has initiated STGs program delivering to the medical officers. We in fact already conducted 3 programs, 3-day program, that is not 1 day. So 3-day program of delivering lectures on STGs, in which we also incorporated the musculoskeletal STGs, which is given by the Ministry of Ayush. So the question which is asked by all the medical officers is the medicines, as he pointed out, because the final thing which comes is on the medicines, and the state government is having some administrative issues in providing the medicines. So unless and until what is my suggestion is, probably is it possible that the Ministry of Ayush also sends the medicines for at least 2 STG programs which they developed, like musculoskeletal disorders and NCD programs. So
medicine,
direct medicines,
not possible.
Or maybe you can also advise under the flexible. You said that
that amount. Actually, problem is this: in-kind services. For example, in NHM, they are providing some medicines, vaccination-related activities in-kind services. In-kind services, they are procuring, there that certain mechanism, and they are delivering and directly to the states, and sanction वो बाद में रिवेड हो जाता है। नेशनल आयुष मिशन में मेडिसिन प्रोक्योरमेंट, पब्लिक हेल्थ बीइंग स्टेट सब्जेक्ट, स्टेट इज प्रोपोजिंग whatever we are providing, that is limited. Majority of the amount states are providing.
Sir, but this is a special program, NCD.
नहीं, उसके लिए your suggestion is very valid, and now we are going to incorporate dedicated amount should be allocated with respect to public health program under flexi pool for procurement of medicine. But you are saying ना medicine we can't understand कि किस बेल्ट में कहाँ पे क्या दिक्कत है। ये तो स्टेट ने डिसाइड करना है कि उसको किस टाइप की मेडिसिन कहाँ चाहिए। फॉर एग्जाम्पल, किसी एरिया में फाइलेरियासिस बहुत ज्यादा, तो वो उस एरिया में फाइलेरियासिस का प्रोग्राम
इन पर्टिकुलरली अबाउट एनसीडी सर।
हाँ, इसका जो ईडीएल में मेडिसिन है उसमें क्या करेगा, जैसे अभी रघु सर ने बताया ना कि कुछ जगह रस औषधि का डिमांड है, कुछ जगह वो नॉर्मल मेडिसिन कास्ट औषधि पे चलना चाहते हैं। स्टेट को ये लिबर्टी देनी पड़ती है सेंट्रली स्पॉन्सर्ड स्कीम में, आप हमसे ईयर मार्क करके अमाउंट ले लीजिए एंड प्रोक्योरमेंट आप अपने जो डिसाइडेड प्रोटोकॉल है उसके अकॉर्डिंग कर लीजिए. उसके लिए हमने कुछ गाइडलाइन बनाई हुई है. स्टेट्स आर प्रोक्योरिंग मेडिसिन, बट वट एवर यू आर सजेस्टिंग दैट इज ऑल्सो बीन नोटेड. हम अपनी एग्जीक्यूटिव बॉडी में रखेंगे इस पर भी. लेकिन क्योंकि होता क्या है ना कि अब जैसे मेडिसिन प्रोक्योर करना मिनिस्ट्री के लिए, स्टेट लाइसेंसिंग अथॉरिटी सब जगह अलग है. मिनिस्ट्री डायरेक्ट कितना मेडिसिन प्रोक्योर कर पाएगी ये, क्योंकि हमारी काउंसिल या कोई भी सब लोग मेडिसिन अपना प्रोक्योर करते हैं. वी आर प्रोवाइडिंग ग्रांट टू द स्टेट्स.
Will you provide the budget under the flexi pool?
Yes, state में project कि this much amount is required for implementation of this particular
NCDs.
activities.
Okay.
And we will consider with due justification. They will submit and we will appraise and approve in the mission director.
Right. Okay. Thank you, sir.
Thank you.
Thank you, sir.